So let's get into our conversation, and I'd just like to reintroduce Dr. Adams, or Jerome. So Dr. Adams is a licensed anesthesiologist. He was actually in the operating room this morning with patients. So he's still a working doctor. He's a master's degree in public health. I know a lot of people here have that. He used to run the Indiana State Department of Health, small budget of $350 million, 1,000 employees. And he led Indiana's response to Ebola virus, to Zika virus, and HIV. So he knows a lot about the subjects we've been speaking about for the last few days. He was also a member of the President's Coronavirus Task Force. And, as we know, he's only the 20th U.S. Surgeon General. And that when he was Surgeon General, he was the operational head of 6,000 people. He oversaw 3 back-to-back Category 5 hurricanes, and that small matter of a once-in-a-century pandemic. And I think what a lot of people, when I speak to Americans about Dr. Adams, what they associate with is his ability to digest complex scientific concepts and communicate them to the public. And it was really interesting. Charlene heads up the one of the committees we're on. With the Environmental Health Committee, we spoke about that. How does ASHRAE take complex scientific aspects and convert them into public knowledge? That's something we were workshopping today, and I'm going to pick Dr. Adams' brains on that today. So currently he's a presidential fellow and executive director of the Center for Community and Health Enhancement and Learning, and he's a distinguished professor of practice at Purdue University, just an hour down the road of it. So again, welcome, Dr. Adams, and thank you. So why don't we start in the beginning? I think everybody loves a kind of a founder story, a story about the real person, about you. I know a little bit about your story growing up. You've been very open about some of the challenges growing up. So maybe could we start at the beginning as a child, where you grew up, some of the health challenges you mentioned about, and really just tell us about your very early life and how you went to school and all those things.
Fantastic. So thank you so much, everyone, for being here today. I really appreciate it. And thank you for the work that you're doing to provide cleaner air and a better planet for our children. My son is here. Eli, where are you? All right, he didn't sneak out yet. I was worried he was going to go over to the event over there. But really, he's the reason we're all here. We want to make sure we are leaving a better earth for our children than the one that was left for us. And unfortunately, right now, we can't say that. We can't say that. Life expectancy has leveled off, and depending on the year, is going down. We know that there are many predictors that things aren't going better. But I think back to when I was a child, and like 1 in 10 of you all, I have asthma. And I've been carrying an inhaler around with me. I turned 50 this year. I've been carrying an inhaler around with me for about the last 45 years of my life. And I've almost died several times. I grew up in a small rural community where no one thought about clean air, indoors or out, where I was exposed to toxins in the field. I literally had irony, and the Surgeon General of the United States and the guy who's on the side of the cigarette boxes. I grew up working in the tobacco fields in Southern Maryland. But I also lived in rental housing that didn't have great ventilation, that had mold and dander and mildew, and that constantly put me in a position where no matter what my physicians did, I was in the hospital over and over and over again. And I can talk more about my pathway if you all would like, because I do want this to be interactive. But when I became a doctor, one of the things that frustrated me, I love practicing medicine. I literally was in the operating room down the street today. I still practice medicine. I also ran the State Department of Health, which is straight down that way. But when I practiced medicine, I became incredibly frustrated that I was seeing the same people over and over and over again. And I was seeing the same people over and over and over again, no matter how hard I studied, no matter how much I adhered to the practice paradigms that of the day. And it was because we know that only about 20% of your health is determined by what happens in a hospital or a clinic. And the other 80% happens in your community, happens in the home that you live in, it happens in your schools, it happens in your churches, it happens in your environment. But unfortunately, we spend about 90 cents of every dollar that we spend on health in this country. We spend on 20% of the problem, hospitals, clinics, etc. And so it's why I got involved in advocacy and why I eventually became State Health Commissioner and Surgeon General of the United States, because I wanted to be able to help people when they had an asthma attack. I wanted to be able to help people when they were suffering from allergies acutely, but I also wanted to prevent those problems from occurring. And that's what you all are trying to do. And that's why when John said, can you come? I said, absolutely. I'd love to come and talk to these folks, because we need to validate the fact that we are spending far too much money on downstream healthcare issues because we aren't doing enough to promote health and wellness up front. And so that's a little bit about me. There's a lot in between that, again, we can tease out. But I went from a kid who didn't even know if I was going to grow up at all. Black boys die disproportionately from asthma. They're diagnosed with it disproportionately. They're admitted to the hospital with it disproportionately, and they die disproportionately from it, to someone who was now in a position to make a difference. And like I said, even as a MD, I can only take care of one patient at a time, and there's 10, 20, 100, 1,000 more out there who I can't take care of. But all of us working together to provide cleaner air and a better environment for everyone, and we can turn that spigot down a little bit. Since my son's there, I'm going to tell you a quick funny story about him that will relate back to the importance of what we're doing. So I came home from work one day, and there was water coming out of the chandelier in our dining room. And he has an older brother who was about 16 months older than him, and they were hellions when they were little. And they had flooded the tub upstairs. So I run upstairs, and I see water coming out of the bathroom and going down the hallway, and I see where it's going into the crease in the wall and down into the dining room. So I immediately run to the towel closet, you grab a towel, and throw it there to try to stop the water from coming down. And I grab another towel, and eventually I realize I've got to figure out where all this water is coming from. And I've got to turn off the spigot. And that's what we do all the time. We keep throwing towels at the problem, but we don't realize that if we don't turn off the spigot, there's never going to be enough towels. And so ultimately, that's what we're here for. We're here to turn that spigot off, or at least turn it back a little bit, by providing people cleaner air, which we know will lower cardiovascular disease rates, will lower pulmonary disease rates, even some data that shows that will lower cancer rates, and ultimately make it so that people like me can go in and not feel overwhelmed when we're in the hospital.
Well said, yeah. I was at the American Institute of Architects, and Dr. Gupta from CNN, he said you're spending $4 trillion on your healthcare budget, and you mentioned it's over 20% of GDP, and it's just unbelievable. I'm going to steal one of your lines about the pulse oximeter. This may be something you don't know. I'm an emergency room doctor. But when we see people with color or African Americans, the pulse oximeter you put on your finger, that underestimates your blood oxygen. And there's been cases of sending patients home because we overestimated their blood oxygen level. Mm-hmm. And you told me that in Ireland, and I was blown away by that. So you were obviously in Washington for a long time. When I've spoken to members of Congress and senators, I talk about investing in the housing and improving indoor air quality. And they seem to take kind of a 1-year CapEx approach to it, rather than almost a 5-year actuarial approach about it. And also I've spoken to politicians who say, well, I can't move the budget from house building to healthcare because somebody else pays the healthcare budget. So, I mean, that just seems incredible that we know the numbers are. If we invest in better houses, better air quality, we'll save those downstream consequences of health you're talking about. So how do you navigate that in Washington? You were there for many years. What needs to happen that we put more money in preventive medicine rather than heroically pulling people out of the fire?
Well, first we have to realize human nature. Nobody likes to take their car in to get the oil changed or get the tires rotated, but they will immediately act if the car is broken down on the side of the road. And so we have to understand human nature, and we have to help people understand the burden that grows. Speaking of cars on the side of the road, he may be at my hospital later tonight. But we need to help people understand how they will be harmed or how they benefit from these interventions. The challenge, as you mentioned, is that Congress runs on a 2-year time cycle. I was with one of my friends who's a congressman this weekend, and they're just always campaigning, and they need ROI right away. That's Congress. I also met with several business leaders with the CDC Foundation, and when you talk to CFOs, they're literally quarter to quarter. They have to show ROI. But I'm not pessimistic because I really do think institutions like Knauf, who are here for the long term, understand that if we don't invest in healthier communities today, then we're not going to be around 5, 10, 50 years from now.
Mm-hmm.
And so I put out a report when I was Surgeon General of the United States that was unlike any other report ever written, because it wasn't written for a health audience, even though I was the Surgeon General, the nation's doctor. And we actually wrote it with the UVA Darden School of Business and with the U.S. Chamber of Commerce, and it was called Community Health and Economic Prosperity. And it pointed out that healthcare is the number 2 expense for most companies, and that our healthcare costs are 3 times the OECD average, but our life expectancy is below the OECD average and falling. And that this is not just a moral issue, it's actually a business issue. And I made the case that businesses need to invest in building healthier communities with sidewalks, with complete streets, with fresh fruits and vegetables for people, but also with clean air. I have my book here, and we've got a couple copies for people who ask the best questions later. But one of the points I make in the book is one of the biggest missed opportunities that we had during the pandemic was our failure to pay attention to ventilation and clean air. We're fighting over masking, which is an individual effort, and we need in the United States to get 350 million people to comply with this, and we're fighting over mandates, and we're fighting over who has access and who doesn't, when if we had actually put more attention on ventilation and clean air, we could have helped tremendously more people with a lot less, I think, political strife. And we wouldn't have just protected them from COVID. We would have helped people like me who have asthma. We would have lowered cardiovascular disease rates during that time frame. We would have helped in any number of ways. And so, again, the point is that we really need our businesses to understand that we're going to lower their healthcare costs. We're going to increase worker productivity. And I know I'm preaching to the choir here. You all are the experts, but the data that shows the kids do better in school when they have clean air, that people are more attentive and productive at work and have less fatigue when they have clean air. We need to help put that information in front of businesses, and then in turn, the businesses will help create a cleaner environment through their direct contributions, through their philanthropic contributions, but also through their advocacy. I'd rather have Elon Musk or Jeff Bezos going to Congress and arguing for clean air than the Surgeon General of the United States. Because that's ultimately what's going to make those people in Washington, D.C. pay attention, is when we make the business case for health, which is what I did with my report.
Brilliant. Okay, so let's move on to the White House. And I know you've gone out of your way at lengths to be non-partisan and be neutral to all this. So I'm not coming this question from a political aspect, but I think we all kind of want to know what it's like to work in the White House. What's it like to be in that press room, face the press? Were you ever in the situational room? Being in the Oval Office and being in meetings with the president, chairing a meeting. Tell us a little bit about a day in the life of the Surgeon General in the White House. What time do you get up? Where do you sleep? Do you go to the gym? Give us a snippet in the middle of the COVID crisis, working for the presidents, doing presidential briefings, being in the Oval Office. Tell us a little bit about that.
Where to start? A picture popped up on my phone today of me and Eli, and it was us in the White House briefing room. And I usually wear a bow tie, and we both have on our bow ties. He had on his bow tie, and we're sitting behind the podium at the White House briefing room. And it reminds me that as challenging as the time was, it was an incredible privilege. It's a privilege to serve your country. And I actually worry that a lot of good people are now not thinking about serving. And if you don't step up and serve, you're going to continue to have a downward spiral in terms of where our country is going. I think it's also important to acknowledge that there are people in this crowd who like Donald Trump, and there are people in this crowd who hate Donald Trump. I'm an independent because as a doctor, I don't have the luxury of only treating Democrats or only treating Republicans. And that's at my hospital down the street, but that's also as the nation's doctor. Well, but that said, there's a lot of people who would say to me, how could you work for that man in that administration? And I'm going to be very real with you all. There are fewer black males graduating from medical school now than what there were 40 years ago. So when you think about the lack of representation alone, when someone asks me, how could you, I ask, how could I not? And I'd also argue that you don't have the luxury of choosing when you're going to serve or when you're going to be called upon to serve. You can't say, you know what? No, I don't want to be Surgeon General today. Call me back when someone's in the White House that I like. Then I'll be Surgeon General. I was just the 20th United States Surgeon General. There's been more presidents in the last 200 years, twice as many as there have been Surgeons General. So you don't get to pick and choose when you serve. And then finally, there's a saying, if you're not at the table, you may find that you're on the menu. And so it's more important that you have someone there who is competent and who's representing your interest when you disagree with the folks who are in power than it is when you have someone who you think agrees with and you can relate to. So I say all that because you asked what it was like. And I was blessed to have the chance to serve. And it was interesting. I was the first Surgeon General in modern times to have school-age kids. And so I tried to take my kids to the White House. He never wanted to go. His little sister was 8 years old and loved going to the White House. And when her brothers wouldn't go, then she'd get to bring a friend. And she was Miss Popular at school because she could bring people to the White House. But funny story is that when you're an 8-year-old girl, you can go anywhere you want in the White House. Secret Service does not see you as a threat once you're on the grounds. So she would run all over the place, and I would find her sitting on George Washington's sofa. The whole White House is like the Smithsonian with no velvet rope. And, you know, she's sitting there eating nachos on this 200-year-old couch, which would horrify me. But, you know, I'd also have to pinch myself and say, oh my gosh, you're here and your family is here. How amazing is that? And it balanced me out against those times when I was getting beat up in the media, and I was getting beat up by, in many cases, the very people who I was there to represent. But I'll tell you a funny story that I told this weekend, and I didn't tell it to be funny, but if people thought it was intermittently are both hilarious, but also very eye-opening. Tony Fauci and I, on a typical day, you get up at about 4:30 in the morning during the pandemic, and you start to get ready because the morning shows start at 6 a.m. and they want people talking on the morning shows. So we're there at 6 a.m. and we go and we do our morning show. Well, actually at about 5:30 a.m. I would check Twitter and see what the president tweeted overnight. I had to learn that the hard way because if you didn't, they throw it in your face the second you got on TV. So I check Twitter. Then we go and do the morning shows from about 6 till about 8 o'clock. And then you run into your office and try to quickly put out any fires that were going on in your office. I was at, I had a 6,000 person Public Health Service Commission Corps I had to run, and Tony was in charge of the National Institute of Allergy and Infectious Diseases trying to create vaccines. So we go in and put out fires, and then we go to the White House. And you had to go to the White House and go through security. And then you waited around for us to have our big COVID meeting, and it was a cool meeting. Situation room. We're in there with the Secretary of Health and Human Services, the Secretary of Housing and Urban Development, the Secretary of Commerce. I mean, just an amazing array. And that's another moment when you go in there and you're just trying to work. But I had to pinch myself. I'm with people who were creating world policy. And world-changing policy, and we're all sitting around a room trying to deal with this very difficult issue where information is coming in by the second, where we don't have a lot of information. And that leads to another point, and I promise I won't drone on, but it underscores why ASHRAE is so important. Because it's another funny story. The president comes up to me one day and he says, Doc, how many people do we have on ventilators? I don't know, Mr. President. Doc, how many hospital beds do we have available? I don't know, Mr. President. Doc, how many people have COVID right now? I don't know, Mr. President. And then he said something in typical Donald Trump fashion that was not so nice to me. But the point of that story is I didn't know because we didn't have the information. We didn't have the visibility. And it's incredibly important that you all do the work to help us understand the science, to understand what's going on baseline, and also how we can improve upon it and what interventions are going to help us improve and create cleaner air. Because you can't make good decisions if you don't have good data. And that's one of the lessons, again, from my book, is that we didn't have good data. So in many cases, we truly were shooting from the hip. Now, it was a hip that was informed by 50 plus years of Tony Fauci being a virologist and my experience in medicine and public health. We weren't just completely pulling it out of nowhere, but we also had a virus that kept not behaving like other viruses every single day. And we didn't have good information. So again, White House press or COVID task force. And then after that, we would go to that's when you see us on TV. So usually around 3 or 4 in the afternoon, we'd get ready and we'd do our COVID briefings. And that whole affair would last literally from start to finish about 4 hours. From the time you're thinking about, okay, who's going to go on? What are we going to say? Everybody line up. Everybody, go out, and we usually wait on about half an hour on air because the cameras are running constantly for the president to come out. And then the briefing would take 60 to 90 minutes. And then afterwards you debrief. And then we'd go back to our offices at about 5 or 6 o'clock, Tony and I, and do more work of our actual day. And then after that, we'd have a convening where Tony and I would say, okay, what are we going to say on the news tomorrow? And then we'd go back to our office and finish work. And then we get home at about 11, 12, 1 in the morning, go to sleep and get up at 4 a.m. and do it all again the next day. And we did that for again, several months, most of 2020. And so again, whether you love or you hate Tony Fauci, you can't argue that he is a true public servant who sacrificed a lot. He and I both got death threats. He and I developed prediabetes and hypertension because I wasn't sleeping and I wasn't eating during the pandemic. I'm in better shape now because I'm able to take better care of myself. But, people pay a tremendous cost to serve their nation because they believe in creating a better world. And we live in an environment where it's the industrial hate complex. People are making money off of convincing us that we need to hate one another because you watch Fox News and I watch NBC, or because you voted for Biden and I voted for Trump. And we need to really move beyond that, or it's going to continue to hurt us all.
Yeah. Well said. Absolutely. I think a round of applause, Riley, and good service to your country and Tony Fauci as well. So maybe anybody in the audience got any questions bubbling up? Okay, we'll go straight. I'll Charlene. So Charlene is headed up one of the talks we gave this ASHRAE, and it's an expert in indoor air quality.
So we know from epigenetics that 10% of disease is you're genetically programmed. 90% is the environment.
Mm-hmm.
I'm a professor emeritus in Georgia Tech, and there was a phenomenal center more years ago between Georgia Tech and Emory, where there was a preventive medicine, and the whole thing was to look at the epigenetics and how can we then prevent disease based on we know that you are targeted towards getting a disease. The prime example I use with people, we know that most addiction is a mess up of 2 chromosomes. If you test your children when they're babies, you know they're going to be addicts. Are you going to teach them to drink? But the insurance company killed us. It lasted 3 years. How do we take care of that? That's what keeps that whole lot insurance loading. Because one of the things that you start with going through the pandemic next.
No, you're absolutely right. So how many engineers do we have on the room? So you all, I'm assuming, speaking to a crowd like this, that you all are familiar with W. Edwards Deming. Deming famously said every system is perfectly designed to deliver exactly the results that it does. Things don't happen by accident. And one of the challenges we have is that when we say healthcare is 20% of our GDP, we're usually saying it as a bad thing. But healthcare is 20% of our GDP. So if you start messing with that system, you're messing with 1 in 5 people's ability to send their kids to college, to pay their mortgage. And $1 in $5 in your retirement accounts right now is going towards healthcare. And so we have to understand that, number one, and create a vision where people see how we shift from where we are now to where we're going without unduly harming people. That's number one. Number two, in terms of a system, we don't have a healthcare system. What we have is a sick reimbursement system in this country. We don't promote health and wellness. What we do, our system really is about diagnosis and treatment of disease. So we wait until you have a disease before you can even come in and see anyone. And then we diagnose that disease, and then we treat that disease based on whether or not your insurance will pay for it. So again, it's a sick reimbursement system. No one gets paid. Well, I tell this story, and I apologize, but I like to tell stories. My son is rolling his eyes. He's like, "Yeah, I bet you do, Dad." And we know. That hospital down the street, I worked there for almost 20 years, and I'm literally sending my kids to college with amputated toes and feet and legs from diabetics and from people with vascular disease. I got paid for every single amputation that I was a part of, and we do a lot of them there. We do a lot of vascular surgery. I didn't get paid a single time to counsel anyone on smoking cessation, to counsel anyone on diabetes prevention, to ask them if they had fresh fruits and vegetables to eat, to ask them about their housing situation. Every system is perfectly designed to get exactly the results that it gets, and our system does not pay hospitals for empty beds. It doesn't pay Dr. Adams to talk about prevention and wellness. It pays Dr. Adams to diagnose and treat disease. And so one of the other things we have to do is shift the payment system from fee-for-service, which is still about 90% of how folks get paid, to value-based care. We need to actually have systems that pay people for health and wellness. And I say this to you all because CANAF is here, but so are many other businesses that are represented. And when you're talking to the people who are paying for your coverage, and you need to ask them, are you going to keep paying for just sick care, or are you going to help look at ways we can change the reimbursement system to incentivize health in our communities? And we also have to ask these companies, because many companies are stepping outside. They're doing innovative things. They're literally sending patients to India to get heart surgery and to Mexico to get knee replacements. U.S. companies, because it's cheaper there. My problem with that is that it's still doubling down on the sick reimbursement system. But I'm hoping that we can eventually get those companies to understand, instead of paying $10,000 for the knee replacement here, or $2,000 for the knee replacement in Mexico, you can pay $200 and help someone move more and actually eat better, so they never need the knee replacement in the first place. And so I think we need to look at these systemic issues and change the way we pay for healthcare, and we need to change the incentives that exist in our system, and we need to create a pathway where that change can occur without unduly harming our economy. Because if you harm the economy, you're always going to lose. You're just always going to lose. We're never going to beat folks who say they're taking away our jobs, and we were talking about that earlier too. In terms of agriculture, they'll always parade someone up there who says you're gonna cost this town jobs, and then you're gonna lose the case. And so those are the things we need to do. They're not easy, but we can't solve problems until we understand the root. And the root is again the system that we exist in that rewards sick care and not prevention and wellness.